Hi, my name is Renee Keen. I am a student with United States University FNP program. I will be recording this video and uploading it to YouTube in an unlisted manner. It will be viewed by my faculty, my professor, and myself. Do you give your consent?
I'm Michelle Phillips, and I give my full consent.
Okay, wonderful. Okay, Michelle, so we're going to do a head, ears, eyes, nose, and throat exam today. We're going to start with your head. So I'm looking at your texture of your hair, which looks good. And then I'm looking at your shape of your head, looking for any rashes or lesions, which there are none. And then I'm going to be palpating your head for any depressions. And making sure that she can hear this. Okay. Any depressions or hematomas, which there are none. And then we're going to move on to your eyes. Okay, so we're going to start off with the Snellen chart. I'm going to stand back right here. Tell me, what's the lowest one you can read?
All of them.
Say it.
LTFPH.
Okay, one. Okay, can you do...
Do you want me to cover an eye?
Yeah, cover that eye. And then do it.
LTFPH.
Okay, do the other eye.
LTFPH, or I can read the line above it, CFDHJ.
Okay, great. And then just both eyes?
I'll read the line above both of those, EPTZO. I almost said zero.
Okay, great. And then we're going to move on. I'm just going to be looking at your eyelids, looking for any ptosis in your eyelids, and looking for any ptosis in your eyes, for any exophthalmos, which is bulging in the eyes. Ptosis is drooping your eyes. And then I'm going to look at your conjunctiva and your lacrimal duct system. And then I'm just visualizing your sclera, iris, and your cornea, which all look good. I'm going to get out my pen light, and I'm going to be testing pupillary response. Your left pupil is round and reactive to light. Your right pupil is round and reactive to light. We're testing for consensual and directional pupillary action. And then combination. So look in here. Like it'll go to you. So you go. Okay. And then over here. So we're testing for accommodation and convergence. Our pupil are accommodating to the size and reacting to the distance. Okay. And then we're going to be testing extraocular eye movements now. This is testing for 3 cranial nerves at once. It is your oculomotor, your trochlear, and your abducens. Okay, so just follow my fingers. When you go right, don't move your head. Okay, and then I'm going to be testing your peripheral vision. So we're going to cover one eye. All right. Let me know when you start to see my fingers. See them? Okay.
I see your hand. I don't see your fingers.
Okay.
I see your fingers.
Okay. And then
down there. I see.
All right. Try the other eye. Okay.
I see him. I see him. I see him.
Okay. And I also forgot to mention there is no nystagmus present when I'm looking this way, which is shaking of your eyes.
And that's good.
Yes. And then we're going to do a ophthalmoscope examination. Okay.
Mm-hmm.
So when it did in the light. Okay.
I'm just looking straight ahead.
Yeah, look straight ahead. Okay, so I see your lens and your red eye reflex, and then I'm going to come in closer. Okay, and then I'm just looking at your optic disc, your cup, and the associated landmark or blood vessel. Okay. Okay. And then reading the next eye. I see the your lens and your red reflex, and then I'm coming closer. Okay. I see your optic disc, your cup, and associated blood vessels. Okay. Okay, great. Now we're gonna go on to your nose. So I'm gonna palpate your nose. Let me know if you have any pain. No? Okay. And then your frontal sinuses and your maxillary sinuses. Any pressure? Okay. I'm going to be looking into your nose. Okay. Pink mucosa. Pink, nice pink mucosa. And then I'm gonna occlude one, and I want you to go. Okay, I'm testing the airflow. There you go. Good job. And then we're going to be testing your cranial nerve number 1, your olfactory. So I'm going to be including, you tell me what you smell.
Vanilla.
Okay.
Vanilla?
Yes, good job. Yeah. Okay, next is you're going to move on to your hearing acoustic. Okay, in your ears. So we're going to perform 3 tests, a whisper test, a Weber test, and a writing test.
Okay.
Okay? So I'm going to include this ear, and I'm going to whisper something.
You want me to plug it?
I'll plug it.
Okay.
And then you tell me what you hear, okay?
Apple. Baseball.
Good job. Okay. The next one is the Weber's test. I'm going to strike the tuning fork. I'm going to put it right here, and you're going to let me know if you hear it in one ear, left or right, or both ears.
Okay.
Both. Good job. Okay. Then we're going to be doing your Rhines test. We're going to start on this right ear, okay? And then I'm just like putting on the bone, and you're going to hear it. You're going to tell me when you stop hearing it, and then I'll put it right here. Okay. You should still hear it. That's gone. Oh, there it goes. And it's gone. Good. Okay. I don't hear it. It's gone. Good. Okay, great. Now we're going to just go on to general inspection. I'm going to be...
Am I allowed to ask questions?
No. Okay.
No, I just have a question because...
let me turn the light.
Did it mean anything that I didn't hear in my ears when you did it up here?
What?
I didn't hear anything in my ears when you did it on my
Oh, you
forehead.
didn't. I probably just didn't hit it.
Okay.
Okay, ready?
I was like, does that mean anything?
Okay, ready?
I mean, I barely hear it.
Okay, as long as you hear it.
Okay.
Okay, were you hearing both ears?
I think so. Okay.
Okay. Okay, all
Wait,
right.
does that mean anything?
No, I mean, as long as you
Okay.
can hear it. So I'm looking at the external ear and looking at your tragus and then palpating it. Okay. And I'm going to be looking at this external ear and palpating and looking at your tragus. Okay, great. And then I'm going to get my otoscope.
Am I allowed to ask questions?
No. No, you're not. Okay. All right, so I'm looking at, and I'm going to start with this ear, and I'm just Just keep very still, okay? I'm looking at your external canal, your tympanic membrane. You have good cone of light, and the associated landmarks in the ear are all present and not in red or inflamed. I'm going to go to your other ear. I'm looking at your tympanic membrane. You have good cone of light, your external auditory canal, and the associated landmarks in the ear are all present and not red or inflamed. Okay. Now we're going to go on to your lips or your mouth. I forgot one thing. Hold on. I need tongue depressor. Okay. I got a tongue depressor. So we're first going to just inspect your mouth. You have nice pink lips. Okay, open up. Okay, great. I'm just going to be moving your lips a little bit. You have good buccal mucosa. Okay. And then I'm looking at your salivary glands. Okay. And then I'm looking at your, open that, keep it open. I'm looking at your teeth, for it to look nice and strong, and no cavities or anything. And then I'm looking at your tongue, stick it out. Okay, and then I'm going to be testing the strength of your tongue, okay? Just push against. There. Okay, good, great. That was wonderful. And then I'm going to open your mouth again. Stick out, say ah. Good. Your uvula and visualizing your uvula and your soft palate. Your uvula deviates when you say ah, which is good. And I see your pharynx and your tonsils. Okay, so the next thing we're going to go on to is your neck. And we're going to be first doing range of motion. So I want you to go forward. Okay, go back. Side. Side. And then circle. Okay, good. Any pain or tenderness?
It's tight.
But nothing limiting. Okay. Now we're going to go on to palpating your sinuses, okay? And then we're going to start out with your preauricular. And we're going to go down to your submandibular, which is your jawline. And your submental, which is your chin. I don't know if you can see me. And we're going to go to anterior cervical, which is right here. Okay, and then posterior cervical. Supraclavicular, which is above your clavicle. And I don't feel any lymph nodes, which is good. That's normal. I mean, you can sometimes, but yours are not inflamed, which would indicate illness. Okay, and then I'm looking at your trachea placement, which looks nice and midline. And I forgot to do one more thing for your neck. So I want you to push against me. Okay, this is touching your cranial nerves. Okay, go put my shoulders. Yeah, there you go. And then put your jaw, go against my, there you go. Good, nice and good strength. Good job. Okay. And then we're going to do the thyroid. So we're gonna, I want you just to swallow. Okay, good. And then I'm gonna be palpating it. Okay. So I'm gonna be finding your cord called.
Am I swallowing?
No, not yet. Here, let's just keep normal. Okay. All right, now swallow. Good. I don't feel any goiter or masses. All right. right, Michelle, that concludes our head, ears, eyes, nose, and throat exam. Do you have any questions?
I don't.
Good. All right, thank you.